Hello again, everyone. It's Sarah from NHC CBT, and today I'm really excited to be here with George Bortnick.
Hi.
So, George is currently one of our part-time clinical staff and also one of our supervisors. So, we're very lucky to have George on the team. And George is an M. LADAC, a master licensed alcohol and drug counselor, and so can work with the co-occurring disorders. But George, I would just love to introduce you to everyone and let them get to know you. So, would you like to start maybe by telling us who you really love to work with?
Sure. One of the things I really like to work with people who are struggling, people who want help but don't quite know where to go. The thing that I've really learned over the past 5 years I've been in this field is most people who come for help want help. They just don't know where to go. They don't know how to do it, and so I like to be there to help them see who they really are, to get to know themselves better. Because a lot of times it's really building up self-esteem. It's really building up finding who you really are, and the more you know who you are, the more you like who you are, the easier it is to, stay recovered, have long-term recovery.
Ah. So, kind of helping people almost like get to know themselves.
Yes.
Yeah.
Yes, absolutely.
And so then they can kind of build their optimal life of resiliency and wellness.
Yes, absolutely.
Yeah.
One of the things that I think about a lot, or I notice, is I call the opiate epidemic the rabbit hole. By the time somebody, we have all these lines that we have. We're not going to do anything on a work night. We're not going to do it here, and then people are just going to snort. They're not going to use a needle. By the time they get to the point where they're using a needle, they're in a rabbit hole. So when they come for help, they're so far, their self-esteem and their self-worth and how they feel about, and how the family feels about them and all the people that they hurt, they have so many layers of the onion they need to peel over. So when climbing out of the hole is the first step, but the rest is dealing with, who they are, and getting to like themselves again.
Aww. Like having permission to feel good about themselves again.
Yes, have a permission to, forgive yourself. There's a saying in this book that I love, Nobody's Fool, where the person says, we don't forgive people because they deserve it. We forgive people because we deserve it. Well, everybody deserves to, and a lot of times people come with trauma or past history, and if they forgive the other person, not because they deserve to be forgiven, but because they need to move on and not hold on to it anymore.
Right. Yeah, I think, and I feel like I can really relate to that in a lot of ways, just thinking about people I've worked with and even just like my own life, right?
Yeah.
This idea of like we can hold ourselves to these standards and to these like internal stories we have about like what a person is supposed to be like, right? Like what a successful person is supposed to look like, or what a good parent is supposed to look like, or a good teacher or a good clinician or whatever. And then we make an error, or we're human, and it can be so hard to forgive ourselves.
Absolutely.
Yeah, I feel like anybody maybe could relate to that. And so George, clearly you work with people who are at risk of substance use, struggling with active substance use, in recovery. I also know that you work with people who are transitioning on their continuum of care. So, like if they have been in the hospital, partial hospitalization, or intensive outpatient, that they can come and see you and our other LADAC team members, and they can do kind of as much or as little as they need as far as treatment to transition, right?
Absolutely. I mean, I've done things from just having an initial assessment. I've done long-term recovery. I work in prisons. I work with people in drug court, both before and after and during. And just wanting to see the transition is really, really a wonderful thing from a clinician point of view, but also from experience. Touching people, hearing their stories, hearing what they need, and just being sort of the guide, the guidance. To me, basic counseling is you're listening and you're just offering support. You're empathetic, and you're allowing them to come to the answers. Occasionally you may have to do a little pushing, but
we had on last Friday I was running a ethics workshop, substance use disorder impact in the law, and we did an experiential activity where we were trying to navigate a client through all the systems,
Yeah.
right? The transition between being in one treatment center
Yeah.
and trying to go outpatient, trying to get back to work, whatever. And like whenever they were going to transition to a new level of care is when we would like drop them, right? Drop them on the floor. There was like a ball we were passing around. It was a thing, right? And so I feel
Right.
like that's so important, right? Because we can be here at NHCCVT to do, as you pointed out, George, those evals, right? So if people need either, if they just are electing to have a substance use evaluation, we can do that. If they're court ordered to have the evaluation and follow recommendations, we can do the eval and provide the recommendations. If they have a DWE, we can do those evals and services. And then we can serve as that bridge. So when people are facing that place where they're ready to start like getting back into building that life, we can be there and we can say like, don't slip through the cracks. It's not all or nothing. It's not hospital or on your own. Like we're here. Let's kind of continue that support. Yeah.
Absolutely.
Yeah. Okay. And then I know we mentioned opioids, but I think you are qualified and able to work with persons who have the co-occurring disorders, meaning like they have anxiety, depression, personality disorders, maybe they have a domestic violence history, whatever, and there's some substance use, either history or current stuff.
Yeah, you know, one of the things that we always sort of talk about is what came first, you know, substance abuse or the mental health diagnosis. So you know, you sort of need to sort of deal with both of them at the same time because they go so in hand. The individual may not even know the difference. So you know, having the ability to know the difference, have the ability to be both, which I've done. Actually, every example that you talked about, done in domestic violence and you know the mental health, personality disorders, you know, all sorts of different substances. I only use the opioid crisis because that's what they were, you know, talk about in the news. But from the point of view of any sort of mental health or any sort of substance abuse, the combination is something that, you know, if we don't get a handle on it, if we don't handle both at the same time, the likelihood of relapse, the likelihood of having other issues is pretty strong. But if you deal with both of them at the same time or focus on the one that needs to be dealt with in that session, then the likelihood of it being successful is increased.
Wow. So we're not afraid of court-ordered treatment. We're not afraid of co-occurring things. You can call us, and we'll say, "We're so happy you called," right?
Absolutely.
And I think that it's also important just to point out that we have a team of people who work with co-occurring disorders, and George is one of our leaders on that team. And so if a person is 12 years old or older in the state of New Hampshire, they can seek substance use treatment for themselves. We, of course, would love to have family support as well. And we've got some of our team members like Jen Paradise, who George, you supervise actually, loves to work with teens and young adults. And you and Jen actually both do expressive art enhanced therapy. So evidence-based therapy like the Matrix model, but you're enhancing it with expressive arts. And so what ages do you like to work with? Are you sort of with like more adults, elders? Are you working with like the 12 and up, or where do you find that your niche is age-wise?
You know, I mean, I'm definitely open to working with any group. Primarily, I work with people who are 18 and over, and you know, you know, I wouldn't say that there's one that I've worked with more than the other, with the exception of probably when I was in drug court, it's primarily, you know, men in their 20s. But you know, in the prison system, in private practice, it's been all age groups. You know, with the exception of I haven't done it under the age of 18. I'm definitely, you know, open to it. You know, it'd be same sort of treatment.
Yeah, I think it's just you haven't worked in a place where you've seen that before. But we've got Jen who does that, and Gary who does that, and then you can do it as well. And I think the last thing that's really important to mention is that as of right now, so we're making this video in September of 2017. George, you are running a continuum of care group. So do you want to briefly talk about that and kind of who that's great for?
Sure. You know, I mean, one of my thoughts and goals from all the different populations I work at, all the places I work at, is that after somebody leaves rehab or drug court or you know, prison or jail, there's usually like an empty time. You know, they don't necessarily have anything. There's not a lot established, and that's the most vulnerable time for relapse is in that. So I've developed you know, this continuum of care, which is to target all sorts of different things. Not only is it working on you know, treatment issues or recovery issues or triggers, it's also going to be looking at self-care. It's going to be looking at you know, financial, you know, how to manage a checkbook, or how to do your daily life skills that you may not have been doing prior to getting whatever treatment it was. Reestablishing with the family is another topic that we'll look at. Being able to understand that sometimes it takes family members a longer time than we would like. One of the things I notice people in early recovery, they want everything to happen quicker, and that makes sense. They're trying and they're working, and they want people to believe them, and they struggle when people don't. So that's another area that we'll sort of look at is you have to learn to accept people's timetable, and as long as you know the truth, that's the most important thing. You know the truth of your recovery, and eventually people will come around. Maybe not as quickly as you would like, but they will come around. So that's another area that we'll be addressing and talking about.
Great. And as of right now, that is on Wednesday evenings, I believe, from 6 to 7:30.
Yes, that is correct.
And so you can have that as a complement to your care. So if you have an individual clinician, either here at NHC CBT or somewhere else, or you're getting ready to transition out of like a IOP or partial hospitalization, and your team wants you to start connecting and attending resources, let us know. We'll do some releases, make sure we're actually part of your team, and we can get you into George's group. And it runs for a set number of weeks, and then you decide if you're ready to graduate or if you want to kind of repeat and you still need that specific support. And so I think that it's really exciting that George is here, and we've got the group, we've got the evaluations, we have got you doing supervision, and we've got you doing individual therapy as well as therapy with a person in recovery and their loved ones. So if you are maybe a partner of someone who has a substance use disorder and you feel like, it's taken a toll on your family, your relationship, like how could it not, right? And you feel like you need someone who's really informed about this and can help you get back together as a team and really become partners again and work through this, then you can call George. Or you can call us and then we'll, connect you with George. Because I don't make him answer the phones. You're good at it, though. Anything else you want to say, George, or do you feel like we covered everything that was important?
Yeah, I think we did cover everything important. I just like to say I look forward to meeting with you, and obviously, I look forward to hearing your story. That's one of the things is sometimes we just need somebody to listen to us, hear our story, hear what it is, and then move from there.
Yeah. Great. Well, thank you so much for watching, and thank you, George, for making the video.
No problem.
And we're really excited to hear from you, so you can call us 603-659-0202. Again, 659-0202. Or email us info, INFO, @NHCCBT, don't forget the double C.com, and we'll look forward to hearing from you. All right.
Have a good day.